Kia ora i te whānau. Just greetings to us on our first Hiwa i te Rangi hui of 2022. I mean, is it too late to say Happy New Year? I never know when to stop. So Happy New Year to those of us that I haven't seen yet. And I've actually seen quite a few of us over Christmas. But it's great to see our faces in this virtual space, in this hui space. Want to acknowledge yourself there, Fraser. No mai hara mai anō. So welcome back to to Hauora Tairāwhiti. You were here initially, and you went across to council, and then now you're back with Hauora Tairāwhiti. Great to see you here. Want to acknowledge all of our staff, Jim, Ariana, Rach, for the mahi that you've been all doing in regards to COVID being in the Tairāwhiti community. And lastly, but not least, I want to acknowledge the members of Hiwa i te Rangi of our board, Hauora Tairāwhiti board. It's great to see us all. Great to see us all this morning. Tēnā koutou, tēnā koutou, tēnā tātou katoa. I will take us. I haven't received any apologies. Rach, have you received any apologies? We'll move on. In regards to the interest register, if that needs to be updated, then please email through to Rach. Other than that, are there any conflicts in relation to the agenda? Cool. If not, I believe
Just noted that I'm a board member of Tūranga Health.
Kapa. Awesome. Thank you, Tiatu. Well, in that case, when are we wanting to do the taumata rei presentation there, Ariana?
If we can do that in committee, thanks, Josh.
In committee. Right. Well, then I'll take us to our previous meeting, our previous meeting minutes. Okay, true and accurate representation of our last meeting. Do we have any matters arising?
Just one from me, Josh, that my attendance is not recorded. I was actually at the meeting in person, not on Zoom.
Thank you for that clarification, Auntie Vicky. It's actually been something that some of my other hui have had to reconcile as well in regards to noting Zoom attendance and in-person attendance, and then also differentiating between the two.
Yeah, I'm just recorded as not being, there's no record of me attending.
Kia ora, thank you, Auntie Vicky. Any other matters arising? All right, we will move on to any actions in the previous. Scroll down further. I don't think there's any on the public agenda. I think we're on the intermittent agenda. Yeah, so nothing for the public agenda. So we'll move on to page 34, our shared services report. Any questions or queries in regards to shared services?
You're muted, Hickey.
Aroha mai. Good to see that there's going to be a ear clinic up in Te Araroa. And I'm just trying to put the two profiles together with the child and shared services. And perhaps my question is relating to the women, children and youth. So I'll leave it for that section. Thank you.
Other questions or kōrero in regards to shared services? Yep, Andy.
Yeah, thanks for that, Josh. Just with regards to the pharmacists in Australia unable to secure MIQ through the COVID response and that now, do you think there's going to be a reasonably timely dealing with that matter, because it's right across the health sector and lots of different things. So do you see that there's anything coming from the government that's going to alleviate that situation? Because it's occurring all over the place, and yeah.
Jim,
Is
if
Jim-
you're answering,
is
you're
Jim
on
talk-
mute.
is
my
Jim
friend.
You're muted, Jim.
Yeah, so there's a little bit more to that story than is encapsulated in there. So we won't go into that detail. But two things. One is that there is a scheme for health workers to get back into the country. It has been for some period of time, and we've been successfully able to get people in. So that has been there, put in place specifically for these sorts of circumstances. And the other thing is, of course, with the border opening with Australia again, then we'll be able to get them, they'll be able to come back and self-isolate very soon. I think that's the end of the month, isn't it? So that will make a big difference to that. And gradually also, we have a number of people that have been in the UK or coming in from the UK as well. And I think that's the middle of next month that helps with that too.
Is there any discussion around non-residents wanting to come here to work? How they can speed that up, or is it just returning Kiwis and Aussies at this? Well, it is at this stage, but is there any talk about it
With the
extending
border
out?
opening, the non-residents comes in later on in the year, but we can get non-residents in if they're health workers and coming to work in the DHB, and we are able to do that now and have been able to do that for some months now.
Oh, okay. Yep. Thanks.
Yeah, Jim. Any other questions in regards to shared services? Because if there's not, I will move us on to medical surgical services report, page 35. Any questions or kōrero there? I just had a question in regards to first specialist appointments. We did a really great job catching us up on FSAs and the SPs in regards to ear, nose and throat when we were like far behind, and because we worked in collaboration with Lakes DHB, and it was really innovative, and I really like that. Do we have anything in the pipeline to meet this current backlog of FSAs? Understanding that this will be the backlog from the lockdown that we had last year, and we're in this kind of Omicron management space at the moment. We're doing something similar or something equally as innovative to bring these FSAs down.
Yes, well, we've got in terms of innovative for this area, we've got a ENT specialist working for us at present who is based in Wellington, but he comes here for 2 weeks of the month, and basically gets in there and does an awful lot of work for us in that comparatively short period of time. So that's helping us to try and keep abreast of this. And also we're still getting that additional support from outside of the district as well, to be able to try and keep up. Things have gone backwards as over the Christmas New Year period. And we are facing a period coming up soon where we're going to have to be prioritising planned care over when we've got probably more of an issue around sickness within staff, being able to staff operating theatres and wards, etc. So we're going to have to try and consolidate as much as possible. So planned care will be an area where we will be having to deprioritise that. And so, yeah, that will create problems. But certainly in ENT, we've been well supported by having an extra surgeon available to come and help us out.
Thanks very much there, Jim. Do we have any other questions or kōrero? Mōrena nā, see you there.
Kia ora.
Do you have any other questions in regards to medical surgical services? If not, I'll move us on to page 36, mental health and addictions. Te ara mai o. Any questions or kōrero whānau?
I just wanted to maybe just add a little bit more in there around the new build. So the concept design has been approved for that, or signed off that by now by all of the stakeholders, and that is now allowing the building to get into more formalized design process for that. And that's going to take probably most of the rest of the year in terms of going through that process and getting it ready to be out for tender. So we're not expecting building work to commence until about this time next year, all going well.
Thanks, Jim. Hey, just in relation to that, combining, I guess, page 36 and the end of page 34 together on shared services report, you allude to the lack of builders. In regards to this build, have we factored that lack of contractor builders, kaimahi, into our timeframes? Like, is the timeframe that you've got in your head and you're giving us is the hopeful and best timeframe, or is it the timeframe that takes into account the lack of builders that's been mentioned already in page 34?
So a few thoughts on that, and specifically in relation to this building, we went out to expressions of interest process last year to signal to builders that this job was going to be coming up and the likely scope of it, and got some responses back on that so that we could get some builders thinking about building it into their schedules. Now, so there was a number of interested respondents at that time, but that will now be complicated by the fact that the project is going to be later. And of course, building is, it's full on. So that, how that works out. So that is sort of best case, not necessarily best case scenario, but scenario planning built around what we know at present and the signals that we've got on what availability capacity might be in 2023. But as we get closer, we'll be have more detail around that. I want to say that we're very in the latest building work that's occurring within the hospital in terms of preparedness around COVID-19. We've been well supported by Pete Dawson Building and helping us out when in a really, really difficult situation in terms of being able to prioritise workforce to be able to do the work. So we've been very well supported there, and Fen Refrigeration as well. And so I really want to give a shout out to those two companies for the support that they provided to the hospital and health services and Tairāwhiti to make sure that we can move on with this work. And so that's also become a priority for us. So some of these other projects, like as described here, are less likely to get done because they're more improvements around flow and things like that, whereas we really need the focus at this precise moment on getting those changes made in wards and ICU, ED to be able to manage the flow of people who are COVID positive.
Thanks, Jim. Any other questions or kōrero or whānau? Okay, well, I'll move us to our page 37, our Women, Children and Youth Services report. Auntie Hiki, you had a
Kia ora,
you want
Josh.
to bring up.
Just a question about the van for women, child and youth. Just an update on why the van hasn't been purchased, and do we expect any impact? There must be an impact on what's happening in the community with COVID and Omicron on mobile services such as this. So 2 parts. An update on why the van hasn't been purchased, and is there any likelihood of any impact on these services with the current Omicron situation?
So I'll answer the second one first, is that they've currently got an van. This is a replacement, so that's not having an impact on the service. But the van does need replacement because it's the end of life. I don't know the exact reason why it hasn't been purchased, Hiki. I know that there's been a whole exercise to define what it is exactly they want, what the equipment is, and all those pieces. But I'll find out from Nikki as to why it hasn't progressed onward.
Thanks, Jim.
Josh, may I?
Yes.
Kia ora, everybody. Morena, happy new year. I just wanted to, I don't even know if it's a statement or a question, but just noting the 50% of the oral health therapists, well, down to 50%. I don't know how many that is in actual numbers, but are we expecting that to have an impact? And I'm thinking about, what specifically around what that means for us at the hospital.
Not so much at the hospital, in the community, for kids' dental therapy treatment.
Yeah.
Yes, absolutely.
Yeah.
It's very difficult to keep the service going at full strength when you've only got half the team available. Again, that's a problem in terms of the supply of dental therapists in the country. We haven't been training enough dental therapists, so that's a familiar theme, isn't it? And and also at present, of course, it's difficult to get dental therapists into the country. And so what we've had there is some people who are dental therapists who have moved on for their own personal reasons to other parts of the country. So other people's gain is our loss, but we're not getting that net inflow here of dental therapists to be able to replace them.
So that I suppose a little while ago we flagged a contract, particularly for the coast, to supply or support them in this area. I'm guessing this will have a dramatic effect on what is already a precarious situation for oral health up the coast.
At this point, that contract, which is for the older age group, the adolescent age group, is continuing. But we know that the dentists in Tairāwhiti are also looking for people, to work for them as well. Because they're short of hygienists and people like that. And so modern dental therapists are dual trained, and sometimes they will work in private dental facilities instead of working as dental therapists in schools. So yeah, that's another pressure, but it's the younger ones coming through are dual trained.
So have these people that have gone of their own volition, have they been poached?
No, people have lives.
Yeah.
They meet new people in their lives, and they go off and
Follow on.
live in other places. Yeah.
All right, thanks, Jim.
Kia ora, no. Andy.
I was just down the bottom of page 38 there. I was looking at that preventing admissions and just wondering if there's a better word choice for a statement like that. Are we wanting to prevent admissions? Do we prevent admissions? Or so I've kind of worked it out now during that conversation. So
where was the question?
Bottom of page 27 under community pediatric nurse response, there's just a bullet point statement that says preventing admissions.
Yes, absolutely. We want to prevent admission.
Yeah. The statement needs
being admitted to hospital is for many families is a major obviously it's a risky and very distressing situation for a child, but also it's quite an economic impact and social impact on them as well. So we do want.
Yeah, I understand that. It's just the way it's just written up as a two-word statement like that. It does indicate that that's our desire.
Yep, it is. Yep.
Kia ora, Ian, Mr. Diamond, me tō pāhau rongonui in your famous beard. Great to see you this morning, my friend.
Sorry, I'm late, folks. It's a bit busy.
No, hey, we understand. Kei te pai. Glad that you did that. He pātai anō whānau, is there any other questions in regards to Women, Children and Youth Service Report? If there's not, I'll take us to our Hiwa te Rangi work plan, which is on page 39. So we've obviously the new work plan is from that green bar downwards. Really just for noting. So I'll take us to page, if there's no questions. Oh yes, Kim.
Josh, I've got one. I'm wondering if we should be asking for an update on our equity investments at some point before the end of June.
Yep, awesome. I'll leave that to yourself there, Jim, to factor in where. I'd also like to see where we are at, and maybe this would come under community collaborative program, where we're at in regards to Rangatahi Youth Hub, like how, we report back in regards to how far we're coming with that too.
Yep, that's good. We've got Ian and Ariana both online, so they'll be able to make a note of those two aspects for reporting through.
Yeah.
Is there anything else in regards to our work plan finding?
Sorry, excuse me, Josh, can I just
that's
ask?
fine.
I'm probably asking Kim this question. You know how we're preparing handover documents for HNZ at a regional level. I'm wondering about at our local level whether we should think about doing the same thing. Like in this case, Hiwa to Rangi transitioning, or maybe not transitioning, but preparing a handover type documentation for, I guess that goes across all our committees. So what do you think?
So I had thought about whether or not we would as individual DHBs. I think DHB chairs probably need to have a discussion about it, but my instinct is that given that Health New Zealand is going straight into a 4-region organisation, that the most meaningful information for them will be handover statements that aggregate up those regions. But chairs haven't had a discussion about it, but I can raise it with Cassandra. We're meeting later on this week.
Cool, thank you.
Whānau, I'll move us to page 40, our COVID-19 update. I'm assuming that the items to discuss are items that you're, like, either yourself, Jim, or Ariana going to speak to?
Yeah, I will. Yes, it's such a moving thing. I didn't put a lot of effort into writing a narrative on this because we need to give you the latest information around that. So there's a little bit of a starter for 10 points to talk about. So phases of the response, you know that we are going from midnight tonight to phase 2 of the COVID in the community response, which will be that phase where we move to a greater utilisation of rapid antigen testing, RATs, in the community. But at this phase, more around people in essential and critical industries and workers in there. And then the other feature of it is to reduce the period of time for isolation for people who are positive, and also the time in isolation for people who are contacts. It's for us in health, it creates a little bit of a dissonance in that the requirements around health workers are different than the general population, and so we've been taking the time to explain those differences for our staff. So our staff, and the principal difference being that our staff who are close contacts can return to work as long as they are asymptomatic and RAT negative. So we are different than the general population, where if you were a close contact, then you would be required to be self-isolating. But if you're a health worker in an essential role, you can come back to work straight away. So we've signalled that and actually been utilising that for some period of time already, but we've signalled that with our staff around that. But it still creates that confusion around, particularly when they get a push notice from being at a place of interest, which is deemed to be one where you would need to self-isolate, and then we are saying, hold it, you can actually come to work. So that is phase 2, and also we need to be getting ready for phase 3. As you saw yesterday, nearly at the 1,000 cases a day mark, and that was on a weekend day. So that was testing on a weekend day. So we will see, I think, a jump up across the country today, as many poor people get tested on weekdays than they do in the weekend. So in our own circumstances, we actually had 7 people test positive yesterday. There was an extra one later on last evening. So those numbers are continuing to rise within our own community. So our ability to respond in the same way to those, to contact tracing, etc., is already being severely tested. So it'll be good when we do move to phase 3 and move away from blanket contact tracing to just contact trace where there are particular issues around an individual or a whānau. We are seeing, I haven't seen the numbers of testing yesterday, but I expect that was up because I could see videos of the queues there, and we have had additional pressures and requirements around testing over the last few days because of the cases within schools. We on Friday put on additional specific testing for Ilminster students and their whānau on Friday, and Ian's just telling you there was 305 tests yesterday. That's a bumper day. We put on additional testing on Friday for Ilminster school students and possibly made a mistake there and didn't actually keep that secret, that it was just for, so it became public. So there was a very large rush at Titania Pro on Friday, and so that was an event to deal with there. And then on Saturday, again, there was testing not quite so bad at Titania Pro and at Watson Park, and obviously in general practices, etc. And then on Sunday, just at Watson Park, and a little bit more manageable. What we've also been doing in testing is being able to prioritize people. So on Sunday, we rapid tested about, I think it was about 15 people who were teachers and particular people that we thought we really needed to get a picture about what was happening. So that's actually helped us to be more effective in working with those schools. I do want to, I'm going all over the place a little bit here, but I do want to absolutely shout out, as we did last evening in the communications, around what a fantastic job those schools are doing in promoting mask wearing amongst the students. Number one thing that has had that huge benefit for those children there, and that it would appear so far that the spread has been contained within those schools where they've been exposed. We'll see with Boys High today with the numbers of test results that are coming back about whether that has been effective there. But definitely what we aren't seeing large numbers or at all from Ilminster so far, and also we have got some test results back from students at Boys High and haven't seen any cases there as well. So that's a combination of testing and the message around mask wearing. Vaccination, we had the excitement on Friday. We were monitoring it minute by minute virtually to find the spot when the last person needed for us to get to 90% total population, 90% double vaxxed, and then very shortly after that, Māori 90% first vax dose across the district. So that was an exciting moment, and we plan to look to, in the very short period of time, the next probably about a week or so, to hit 90% for Māori second dose. So those are really big achievements, and you all know that that is a combination of the drive and determination of people, whānau here in Tairāwhiti, to be vaccinated, got the message and have got out there and got vaccinated. And it's taken a while to do that. There's specific and unique circumstances for many of our whānau in Tairāwhiti who haven't been able to just get out there straight away and get done. And we've needed to work with whānau to build their confidence around it. But I have to then really say thank you to all of the people who've been involved in actually helping to build that confidence and to actually give the vaccination. So the team at Tairāwhiti Health, the team at Ngāti Porou Hauora, our team within Hauora Tairāwhiti, and then more latterly our hardworking teams within general practice and in pharmacies around the district who've come in behind it in the latter part of the campaign just wouldn't really have been possible at all without that combination of you know, Tairāwhiti people standing up to my Tairāwhiti and the whānau within the vaccination teams. They've been you know, those people have been working non-stop for months now, 7 days a week, long hours, in sometimes really unpleasant conditions, in drive-throughs and howling gales, in drive-throughs and small you know, halls and things like that, in really, really hot temperatures, all PPE, for them, the swabbers all PPE up, but these people also wearing PPE. You know, if you've had the opportunity to go to some of the events, you'll just know what a full-on event those things are and how much effort is required to organize them and to make sure they run well. I think it's important to also recognise the work, the effort that Tū Mai Tairāwhiti put in to promote, and all the other promotions and our comms teams across Hauora Tairāwhiti and then the various other organisations in iwi for being right behind it and pushing it and enabling people to be able to do that. You know, particularly the role of iwi in supporting the whānau within them to get vaccinated. And of course, you know, the goal is still 100% for Tairāwhiti, and we're at 94% first dose now, so for adults, that is. And I do want to particularly mention Dai Rangi and the work that she's done, often as the face of vaccination in Tairāwhiti, being out there on her large number of Facebook Live posts in relationship to that. The job is not done, of course. As I've said, we're not at 100% vaccination, certainly not at 90% second dose for Māori, and we've got our boosters and our 5 to 11s. 5 to 11s, we're concerned about the fact that only 25% of 5 to 11 Māori are vaccinated yet. So we know that Ngāti Pro and the team are putting some effort in this week, and I know that also the money through TPK to iwi is specifically targeted as one of the areas, $4.8 million to iwi, just coming through TPK to support iwi in a number of areas, but one of those areas is to support whānau to enable their children 5 to 11s to be vaccinated. So big piece of work there as well to be able to keep on the momentum around children. The boosters, we're at around about 60% are boosted at present for the eligible population. Need to keep on moving that up. Boosters are our main area at present about what people are getting, and actually for Māori that is pretty good. We're holding up there, comparing well nationally around boosters, but not so good on childhood vaccinations. So the effort needs to go in there. Hospital readiness. I've just talked about the fact that we've got the building work going on. We're able to complete some of that prior to Christmas, which is really good. And so that's enabled in our emergency department to be better equipped around negative pressure areas to assess people coming in through there, and also work on them if they need resuscitation, because obviously intubating somebody is a aerosol generating event, and we want to make sure that that doesn't result in cross-contamination for our staff or other people, other patients within the department. The work in ICU is progressing well as well, but not as fast as we would have liked. We would have liked this to have been done probably 5 years ago, but even a year ago would have been better. So next pandemic, we will be better prepared. We'll have a hospital next pandemic that will take it from its 1980s construction through to something vaguely 21st century-ish when it comes to preparedness around managing people who have a respiratory illness in a pandemic. It's still going to take us at least another couple of months to get done. We're working simultaneously within Ward 5, ICU and Planet Sunshine at present. So thanks again to the builders from Peter Dawson Building that have spread themselves, and we've got help from other builders and other tradespeople in Tairāwhiti to have a bit of a campaign to get this work done. Primary care readiness. we have been very well supported by general practice as the numbers of people with COVID has started to increase, and the management of people at home by general practitioners. The general practitioners have been really consistent in managing the care of their practice, their enrolled people and their practices who are positive. We have got 7 days a week, 24 hours a day cover for those people, because of the way in which the general practitioners have worked together with our doctors working for us to be able to make sure that that is possible. And, you know, we can't, at that sort of link leading into the thing about response, but Takatū and it's the way in which it's worked has proved very successful in being able to wrap that clinical care around people who test positive and the welfare needs around that. We've spent a lot of time talking and working with iwi about how we integrate that as best we possibly can. I'm not going to tell you it's been perfect from day one. It hasn't. We've learnt a lot on the way. This has really been a really good opportunity to demonstrate for ourselves and for iwi how mainstream and health services and MSD, for instance, can work more effectively and better with iwi in a situation such as this, which of course has flow-on effects elsewhere. So it's been a really good example of building on what we already know and what we've been working on through things like Manaaki Tairāwhiti and our relationships with iwi to take that to another level. But this has taught us even more levels that we can go to be more effective and for iwi to be able to be responsive to iwi members. And of course, it's just I've said the support that's come through from TPK and Tairāwhiti has empowered and enabled iwi to take that place. And I know that they need more support to be able to do that as well. So that's kind of like primary care and community care. Masks, they work. You know, we've got an outbreak we've got a little cluster at present, which is from a group of people who were at an event without masks on, and they were singing, and kabam, you know, people are getting it from those sorts of situations. So yeah, just masks, source control.
Hey Jim, can I just can we take these in like 4 chunks of preparedness, response, IT? I just want to see if there are any questions in regards to the first part, this first bullet point, or any questions or comments from the committee. Andy.
Yeah, thanks for that. Yeah, mine was on masks. I don't envy the schools enforcing mask wearing, but it could possibly need some tightening up. There was some communications that come through on Facebook a few days ago about a mum that sent her child off to school with one mask and came back with a different mask. So, I mean, obviously it could be just a one-off, but it would be something we'd have to really get on top of, because that's a very critical error.
Yeah, I mean, obviously there's going to be problems, and I guess we're not quite sure of the details. We've just because of the issue around mask availability within schools, particularly for low decile schools, we've just provided 25,000 masks to low decile schools in Tairāwhiti. And it may be, I don't know what the timing of this was, it may actually been that the child was changed over to a medical mask at school and provided for them, so that we've got, you know, some decent so everybody in the school has the opportunity to be masked up with a mask that's going to be effective for them.
Yeah, hopefully that was the case, but the mother was adamant that it was a used mask that the child came back with. So yeah.
Okay, that's unfortunate, but you know.
Yep.
Yeah.
Good answer, Hiki.
Kia ora, thank you, Jim, for that update. I just want to, in the area of preparedness, I want to give acknowledgement to all the people, and I'm talking particularly in our community, Tokomaru Bay, but in every other community, who help whānau prepare their plans for isolation. You know, the work, the planning and the sharing of information, getting things ready, getting things printed have proven invaluable. As someone who has observed a whānau in isolation and helping to prepare other whānau to develop their plans, the work that has been done to get our community and our whānau ready to cope with being in isolation, etc., has been invaluable, and we really appreciate it. And I'll just mention one, Lillian Taho from GDC, fantastic work. So kia ora.
Kia ora, Auntie Hiki. Hey, off the back of that kōrero, I do want to echo the same congratulations that Auntie Hiki and yourself, Jim, have stated on this during our community hui, or during our committee hui. But I do want to congratulate our healthcare workers and Hauora Tairāwhiti, our iwi partners, the GPs and the pharmacists, and also our whānau, hapu, iwi and community for incrementally getting us there. This has literally been in everybody all in kaupapa, and we've gotten ourselves there. Like how you acknowledge, Auntie Hiki, the Tokomaru Bay whānau, just over my back fence is Te Poho Rāori, right? And I will hear the music being played by the kahau rangatahi, or the DJ that they've got there, Billy Maxwell, or his son, Wiremu. It's all of those other parts as well that make those events go. Not to mention Auntie Shah and all of the whānau, all of the Te Kani Gibson whānau, they're indicative of whānau groups all around our rohe. So you're absolutely about me mihi ka tika, Auntie Hiki, you're absolutely right to mihi to those groups of whānau for getting in behind and supporting our various whānau around their planning and around getting our vaccinations up. I do want to specifically acknowledge yourself to the Jim and your leadership team. Because we're part of the board and we're on this committee, we know firsthand how much you, the management team, and our staff are working. So, and in every comms, and rightly so, you're not patting your own back, you're talking about the community, you're talking about the team of Tairāwhiti. We talk about, Jacinda will talk about this team of 5 million nationally, and I like how we talk about Team Tairāwhiti in regards to this. Every time you're acknowledging the team, and I think it behoves me as a chair to acknowledge yourself, Jim, and also our exec team. So I really do want to acknowledge all of the awesome mahi that our region has been doing, from this table across all of the tables, the kitchen tables, the other board tables, to get us to our percentage in regards to vaccination, but also to keep ourselves safe. In regards to masks as well, like I've seen, because I was at Ngauri a Māui talking to them about leadership and what that looks like from a council health board perspective. And everyone had their masks on there, all of the kaiako, all of the students, and yes, it was tricky, and I do not envy them for having to do it, because it's a teacher's primary job is talking and interacting with rangatahi. When you have this mask on your face, it really impedes your ability to be able to flow in regards to talking and interacting with your rangatahi. But everyone was on board, and you're right, Jim, those things will help us limit spread. That's why it hasn't, that's why we've had incremental spread, but not as much spread as we would probably have gotten had masks not been worn. So I do want to, in line with acknowledging our workers and our community around doing the things we've needed to do to bring up our vaccination rates and look after ourselves and each other, I really want to acknowledge those little groups like school groups and kaiako and teachers that, despite the impediment to them being able to do their passion around teaching our future leaders, they're also doing the things to help limit spread. So just really want to acknowledge everyone in regards to that. One question I wanted to ask, Jim, was around, at the start you talked about phases of response, and I did see that those that are essential workers, that have a negative rat test, etc., are able to come back to work. Is there still? Does that mean that we will be expecting them to come back immediately as soon as those tests are negative, or is there space for them to be able to be precautious? What's the balance there between us needing them inside of the health system to be able to look after, do things like plan care, do things like pre-planning around Omicron. What's the balance between that and also them taking a precautious approach in regards to their health and well-being and possible transmission and stuff like that? Are we giving consideration to that?
Yes, so it's not sort of a blanket approach as I might have described it. So we will be doing an assessment with the individual around what the situation is. It will depend on what their job is within the system as well. So if they were an anaesthetic technician or an ICU nurse, then we would be looking at trying to get them back as quickly as possible if they're a close contact, and also looking at the risk level involved in the contact that they might have had within the community. And so that's a factor within it. But clearly, if people and our staff are pretty good at mask wearing and being and taking care within the community, so if the risk level is low, they need to monitor for symptoms. So as I say, symptoms are really important, but if you're double vaxxed and boosted, your symptoms are quite possibly going to be quite mild, and people can be asymptomatic and positive, and so that is another factor to take into account. But you know that for us working within the DHB, everybody that's working in clinical areas now, anywhere where there's clinical care taking place, are wearing fitted N90 or N95 masks, and the majority of people are fitted N95 masks. So we are really closing down the risk factor there for those people coming back. And if they do start to become symptomatic, the rats should pick that up. But also we've already got them mask wearing, so the chances of transmission are low. And it's going to get to the point where it's circulating so widely within the community that it's really people are going to be exposed all over the place wherever you go. We've made it clear that we did have an incident at the weekend where one of our staff members has tested positive, and we were able to go through quite comprehensively over the period of time about where they've been working, who they've been in contact with, and what were the situations where they may have been exposed. So we were able to isolate down to a small number of people who were one person who was a close contact and a couple of other people who were casual contacts of that person. So the primary factor involved in being able to do that and so definitively define what the issue was in terms of exposure was the fact that that staff member had been consistently wearing an N95 mask the whole time at work, and only took it off when in a tea room situation, and that's where the exposure occurred. Mm-hmm. So we've been working with our staff just to make it clear that the only times that you can have your mask off is when you are when you're eating or drinking, and even then you need to be socially distancing and avoiding taking your mask off for more than 15 minutes at any given time. And we've got restrictions on the number of people who are able to be in staff rooms depending on the size of them. So we've got to stagger utilization of that. So that's the Achilles heel in health, is people taking their masks off to eat and drink. And so that's where we are, where we put some additional guidelines in place to be able to try and reduce that as well.
Okay, thanks for that there, Jim. In regards to your conversation or your comments around that people can be asymptomatic and test positive, you're absolutely right in regards to that. I was wondering, is there a standard multiplier that we're able to apply to positive test case in order to be able to get a feel as to actually how much possible positive people are out in the community that are possibly asymptomatic and haven't come through for a test? Is there some kind of standard multiplier there, or is there not?
We know that, the international evidence is that for Omicron, the R factor, or the number of people that one person will infect, is 6. And that is where you've got people who are spreading. So they're not wearing masks, they're not doing anything to be able to control the spread, and they are engaging in activities so if you get a group of people and they're not wearing masks and they're all speaking loudly, or they're singing, or and they're all in a room together, then you're going to effectively pretty much everybody in that room is going to get infected. So, but what we know in this and they're not vaccinated, and so in this country we know we've got comparatively high rates of vaccination, we've got comparatively high rates of use of masking, we've got reasonably people are reasonably good at getting the concept of if I'm out of my home bubble, then everybody else around there may be positive and I may be positive and not know it. So I need to wear my mask so I don't infect you. You wear your mask so you don't infect me. All of those sorts of things. And I just, Anil shared with me last evening, and I'll find it in a second, a graph about what's happening in Auckland, because I think it's quite useful to show about what they're seeing there already. I'm not sure what I did with it, but
Jim, I've got it if you want.
I have you. Yep. Pop it up. Just that. Oh, I've got. I just want that first one. That first. Yeah, I can share it. Ian. So you can see there, let's make it larger. This is what's happening, what the northern region are seeing already in terms of transmission. So they're seeing that tracking up the low transmission graph. And the low transmission graph is where you've got those really good controls, public health controls in place. And so you can see there, if you read that korero just on the side there, what it's saying is it looks a little bit like South Australia as opposed to New South Wales. Or London, and so that's looking good. Very early days, and here's what, if you blow that up a bit, that's what it looks like more. So it's certainly gone up a lot and more recently. I can tell you that the number of national cases today is down on yesterday, so that's a good thing. So I'm surprised, because normally a lot of people turn up for testing on a Monday after the weekend, so that is interesting. So we'll see how it goes. I haven't constructed what that graph looks like for us yet, but we'll be able to get that done, I think, and see what we're looking like. So that's again evidence, if people need evidence, that if you get out there, you vaccinate your people, you boost people, you get them mask wearing them, you make sure that they are socially distancing, that they're doing all those and washing their hands and all those sorts of things, you can have an impact on a pandemic.
Awesome. Hey, thanks very much, Jim. I'll move us into the next bullet point, into response.
So response, I've talked about Takatu and the public health and welfare and primary care. Just to note that the public health component will start to decrease as we get more and more cases. We're not going to be needing to know where people have got the virus from so much anymore, because we're not trying to stamp it out or control it in that way. We're going to be concentrating in on the care of people, their clinical care and their welfare care instead. I've talked a little bit about the partners already, and the fact that they've been so important in response. SIQ, we've been consistently utilising the flats that we've got available here. Now we've also been utilising some of our camper vans. We've only got 4 left there. I can see parked out there, so I've got 2 of them out, I know, being used at present to support. We know that there's additional capacity that Tairāwhiti Health have put on at Te Kuri Marae, and that also we've got, I think, Ian, we've now got a contract with Hicks Bay Motel for units there to be able to supply some capacity up there as well. And there are other options. People themselves, over the weekend, a person who was positive organised his own place where he could go and keep separate from the rest of his whānau. So people are using their own thoughts and resilience around that. And MB are stepping into this as well and have organised with Orbit Travel as a national provider of options for people. So you give Orbit Travel a ring and they find somewhere for somebody to be able to go to self-isolate in. I've been informed today that there are 2 providers in Tairāwhiti who are able to, who work with Orbit Travel, who are able to do that. So I need to find out myself more details around that, because that'll be interesting to see what those ones are. So that's the situation around SIQ. It'll be interesting to see what happens when we're in the 3rd phase around how SIQ works, because many whānau will be just wanting to hunker down and as the numbers of people within the household become positive, that it'll just gradually progress through. Some whānau won't have major illnesses, so they'll just hunker down and see it out, whereas others may need still that support from SIQ. So that's the response section. Any questions on that one?
Andy just asked a question on in chat about the graph that you shared. Why does the medium graph drop back so much quicker and go further down than the low one?
Let me just have a look.
Ian.
Yeah, it's when you are controlling the pandemic and limiting its impact, you are not changing so much so what you're doing is literally taking the top off the peak. So that the peak is the problem, a particular problem for health services and for the community as a whole. So if you've got a large proportion of your population who are sick at the same time, there's nobody available to take the rubbish away. There's nobody available to care for you if you have a heart attack, because everybody's away sick. So that's what that low transmission graph is about taking the top off it. But you're probably still going to you just slow down the transmission, which is what we've been trying to do in phase 2 and phase 3, is just say it's out there, but let's not all run out there and get infected at the same time and all be off work sick at the same time. Let's try and spread it out as much as possible. So that's why it goes longer, because it's still going to find people in the community, particularly those people who are not vaccinated, and it's going to infect them it's still going to get them. And yeah, so they'll just take a little bit longer to get to them.
Sorry, just is the same number of people infected, it's just in a shorter time frame?
Yeah.
Thank you. Right, IT and comms.
Yeah, IT, there's 2 systems. It was called BCMS, which is Border Control Management System, now called CCCM, and COVID Community Control Management or something, maybe CCCM. Ian, do you know what that CCCM is? No. Anyway, it's been continually upgraded, and it is the main format which is utilized for monitoring and sharing information around primarily the clinical care of people within the community. So general practitioners and others, people can access that as well, and that's the method of communicating what happens. It's populated by information out of the national NCTS, which is the National Contact Tracing system, which is where all of the people who are positive results get put in. So those 2 pieces of software have been quite important, and they've required a lot of upgrading and continual education for the users to make sure that they understand and keep up to date with the use of them. Added to that is the new software that is now available, which will be utilized particularly in phase 3. So in phase 3, you're at home, you feel you're starting to get a tickly throat, you've got a headache, you're feeling a bit tired, and your nose is starting to run a bit. So you think, I think I might have COVID-19, Omicron. So you go onto your computer and you register within the system. I think it's in My COVID vaccine site that you've already got an account for. And in there, you can click on into the software there, which will then enable you to register within that software. And then you will get a text to your phone, which will give you an invitation to get tested, to get a rat test. And then you will then, and I think at the same time, we'll tell you where you can get one from, but in Tairāwhiti, you will then, if you live in the city here, you will either go to Watson Park, show your QR code and get your test there, your rat test there. And I think it also gives you, if you say that you're in a household of 5 people, it will give you enough rat tests for all 5. And then if you want to, you'll be able to go to Te Tini o Paro to a drive-through there and get your rat test there. Or if you live on the coast, you'll be able to go, they'll be available at the clinics there or out at Western Rural. We haven't yet organised yet, I don't think, with general practices about whether they're going to have them available yet. There's an issue around it because many providers don't want large numbers of possibly in COVID-19 infected people coming into their premises. So it really needs to be contactless. That's why we're using a drive-through. Or in pharmacies is another option that may be able to provide it. So we need to that. And also, we are going to be able to try and find ways to get test kits to people who maybe live in more remote locations. So we'll be relying on community nurses and things like that to drop those ones off. So you get your kit, and for the large proportion of the population, they'll just take their kit and they will do the test themselves. It's a very easy swab, both nostrils with the same swab, stick it into a little test tube, squidge the test tube, squidge it around inside. The instructions are slightly more detailed than this, but I'm just giving you the general impression. Squidge it around a bit inside the test tube, put the cap on, tip it into a little test plate, tip a few drops into a little test plate. Those people in the population, if you completed a pregnancy test in the past, will instantly identify with the little test package and little test kit and the dropping of the fluid into that. And then you wait 10 minutes and then you get a reading out of that, and it'll tell you if you're positive, and it'll tell you if you haven't got it right, and it'll tell you if you're negative. If you are positive, you will then go back into the system that you originally went into, and you will enter your positive result in that, which will then populate the National Contact Tracing System software, and it will also then prompt you on to have a questionnaire around your health status. What sorts of things are going on for you? Have you got high blood pressure? Are you maybe a little overweight? Are you pregnant? Those sorts of things. If some of those areas, you will then be prompted to go and get a PCR test, because we need to know a bit more about those people who are at risk. So it's a risk stratification tool. And also there will be a link into a welfare component of that as well, which will ask some questions around, for instance, how many people in your household are you, will you be, I don't know how blunt they'll be, have you got enough food to be in isolation, all those sorts of things. It'll give you definitions and information around how long you have to isolate. It will check in and ask you to contact trace. So it will ask you to make sure you've got enough tests to test everybody else in your household and make sure they get into the system. And then also, like last night, you had 10 people over for dinner, and you all sat around after dinner with a guitar in a room with no masks on, and you all sang to the tops of your voices. So maybe a good idea to contact all those people because they're probably going to be positive in the next day or two. So that's the pathway. You are able to do it all yourself. And you're going to be okay pretty much in your home. But then there is that capacity to be able to switch through that to highlight you within the system. And what we are expecting to do from a health perspective around that is that if you flag up within that as needing some more health things, that will then come back to us as the DHB and Takatū, and we will be looking about how we can put that care around you from a personal health point of view with your GP, to be able to monitor you and take care of you. Because your results gone into the NCTS, we will be able to see it in Tairāwhiti, and we will also at Tairāwhiti Hub, as long as the numbers don't get too large every day, be able to go through all of those people who are testing positive, just as we do now, and say, aha, that's Jim Green. You know, he's a patient at Three Rivers Medical. We know him, you know, we know him pretty well. You know, I'm reasonably healthy. You know, he should be fine in terms of that. He's not a priority person. We don't really need to worry about that. He will know that if he starts to get unwell, he's going to contact the general practice anyway, so that's fine. As opposed to, you know, somebody else that his name pops up and we check in with the general practice that they are, and they say, actually, we're working very closely with that person at present. They've just commenced their cancer therapy. We'll contact them, and by that stage, probably the message will come back through the other point, saying, you know, the person themselves would have said, I've just started my cancer therapy, and that will ping both ways to come through and pick them up. So that's that. And meanwhile, MSD will be getting, when the people fill out the form saying they've got welfare needs, MSD will be getting that, and MSD are already linking in with iwi around sharing that information with iwi and saying, here we've got a person who will contact them and see whether they want to have support from us as MSD and from iwi. And similarly, if we get them around the other way, we'll also, because of our setup within Takatu, we'll be taking the other way. So this is the person who's done it all themselves. We also are going to offer within our drive-throughs and within our clinic areas the able to support people. Many people will have no access to devices. They won't have even logged themselves on, so they wouldn't have got an invitation to pick up their rats, but they would have gone to the drive-through to get tested. So they will be rat tested at the drive-through. They'll either be logged into the system and given their rat test to take home if they're able to do that, and then have the ability to get onto the internet afterwards and enter it all. Or alternative, we'll provide support for them to be able to do their rat testing to log on and be able to do their rat testing at the drive-through or at the clinic. And then if the test result comes back positive, support them into the system as well to go through, fill out all the information within it, and if necessary, link them up immediately to general practice or Takatu, so we can link up with general practice and welfare services. So much the same process about that, but just a supported line to make sure that we don't leave anybody behind in Tairāwhiti in this next phase. Long-winded, but that's phase 3. That was actually about the IT question. And I guess it's also been a little bit about communications, because this is a lot of information that we need to get out there to the public and understanding. And I'm thinking a lot of people won't really be into it until the day they start to feel a little unwell. The only other thing I'd just add further to it, and you highlighted before, Hiki, is around the whānau plans that people have got or will have made hopefully by now, in terms of how they are going to manage within their own whānau as they self-isolate. In phase 3, I'm pretty sure that the time frame comes down to 7 days of isolation if you're positive, and 5 days for contact for close contacts, and then rat testing to get out. So there will be, and the other point is you'll manage your own you manage your own isolation and self-isolation. So you won't have public health saying you're okay, you're cleared to go out now. You'll be, after you've done your numbers of days, you'll be able to get out again with some rat testing to give some certainty around that. So you'll be supplied with your kit of rat tests for that period of time. Hiki.
Just a couple of things. When you talk about the help for people who aren't able, or don't have the skills to take part in the rat testing and all the surveys, I would imagine that groups like Ngāti Hauora are going to need a lot of support because, you know, not everyone in our community has the ability, the desire or whatever. And I can just see an upsurge in support being needed for groups like, I'll say Ngāti Hauora because that's the provider in our area. The second thing is, you know, you're right, Jim, there's a lot of information coming out, you know, and I see people in my community, they just switch off. However, the information that they really hook into, and it's, you know, I want to pay tribute to, I know it's something you do all the time when you come up and present the updates on Tairāwhiti's Facebook page, and it's the one that our people hook into every day. They're kept up to date. But the key messages that they hook into are what you promote. You know, get vaccinated, stay home if sick, wear a mask. You know, a lot of, I won't say a lot, people in my community, they're pre-mask days, and I'm going to venues and occasions. People rock on up. You'd be surprised at the number of people who wear masks, but even more surprised at the number of people who don't wear a mask. You know, and it's about keep saying those basic principles of good public health. Wear a mask, record your movements, improve ventilation. You know, we're still having meetings, promoting all of these basic messages where we can to individuals and to groups. And that's why when I hear those messages at the end of every public health promotion from Tairāwhiti, I really appreciate that, because that's what a lot of members of my community can relate to. And they rely on others such as us to develop those messages, work with them, and also to have the support that Ngāti Hauora needs. When they hook into the system, they're going to be supported once they start the rat test, you know, journey.
Yeah.
Kia ora.
So just on the support issue, so at the moment we've got a whole sort of group of people who are very much involved in contact tracing and that part of the response. So those people will stop doing that, and they will all switch into rat testing and supporting people around that. We will definitely need to be stopping a lot of business as usual type activities within organisations, Ngāti Hauora and Hauora Tairāwhiti, etc., to be able to redeploy people to those areas. Ngāti Hauora, along with Tūranga Health, have taken on 30 extra workers that we're funding to specifically work around these areas and be involved in that. We're just taking on another 30 people as well within Hauora Tairāwhiti to give us some more capacity as well. And then also we are fortunate to have the support of other organisations, sort of like what do they call themselves? Help, Ian and Ariana, that have already offered to provide support around getting in there and help with rat testing and rat distribution.
Artified Trust.
Artified Trust and sport.
Yeah.
Sport, yeah. For instance. And we've had other offers from other organisations as well to help support, because, you know, even, you know, it's going to be a sort of a, I don't know, X number of weeks period of time as the number of people out there are gradually increasing, requiring rapid antigen testing, and we're going to need people to be able to support that. At least we will be doing a lot less PCR testing, and that, as if you know, that takes time. By the time you've registered the person on, you've got to have people in PPE to be able to do that. You're going to need that at rat centres as well, but also then you've got to do the swab, all of that sort of thing, quite labour intensive. So rat testing will be a lot less labour intensive, because mostly we'll just be handing out the rats. But yeah, obviously sometimes we'll be helping people, and people, it's very much easier than a PCR swab. It's going to be hard. Yeah.
Thanks there, Jim. If there are no other questions or kōrero in regards to COVID-19 update, do you have any others, Bana? Well, in that case, I will move. Thank you very much for your thorough report, Jim, and I completely concede why it's bullet pointed out, because you're right, it's a moving feast. things are changing on the fly. So very grateful to have the most up-to-date information. So thank you very much for that, Jim. That is our last paper in the public agenda. I'd like to thank the throngs and masses of people from the community that have tuned into the YouTube to watch this very interesting committee agenda. I will move us into our in-committee part of the agenda. Whānau, I just wanted to check to see if we wanted to take 5 minutes for